Let's turn our attention to something that is clearly the headline du jour since back in February, and that would be COVID-19 and the coronavirus. We want to bring in Yahoo Finance health correspondent Anjalee Khemlani because there's so many headlines crossing right now between what the president said about Anthony Fauci to the number of new cases. Take it away because it drives markets.
Right, Adam. I quite honestly don't know where to start. So let's start with the numbers because that's easiest. Obviously, we know that we've seen, unfortunately, a really surprising numbers in the past week. We're steadily growing at more than 70,000 cases per day, almost reaching 100,000 cases per day. And that's really, these graphs are just jumping as a result. We've now reached more than 9 million cases in the U.S. with more than 231,000 deaths. And that's a jump from last week when we were just at 226,000. Meanwhile, globally, we know that the numbers continue to rise, more than 1.2 million deaths and more than 46.8 million cases, nearing that 47 million mark. Now, when we're talking about all of this, obviously, all eyes on what is happening with the election and the federal strategy that has been unleashed, or lack thereof, according to many experts in the U.S., and what that means for the potential to curb this really rising outbreak, with some of the health experts like Dr. Anthony Fauci being central to where we've been getting news and information from. And so Dr. Fauci came under fire from President Trump over the weekend at a rally, saying that he, after a chance of fire Fauci from the crowd, Trump sort of indicating that post-election that could be a reality if he does in fact win. And even if not so, that there was something that he could think about. And so that's bringing, of course, some concern because as we've seen, there's been a lack of sort of strong scientific influence in the White House right now. People pointing to Dr. Scott Atlas as sharing and distributing some really unrealistic strategies. And so that's something that we're really focused on right now, what that means for the future of the federal response to the outbreak.